Hi, I'm Karen Jacobson. I'm an infectious diseases physician with the Permanente Medical Group in Oakland, California, and I'm also a research scientist at the Vaccine Study Center in the Kaiser Permanente Northern California Division of Research. New patients and patients who are planning to get pregnant should continue to follow current clinical guidelines. And according to the American College of Obstetricians and Gynecologists, or ACOG, that means getting an updated COVID vaccine as soon as it's available, regardless of the timing of pregnancy or whether they're preconception. The primary role of maternal vaccination is to protect the mom and to protect the pregnancy. We know that vaccinating the mom helps prevent all the complications that COVID infection can cause in a pregnancy, including severe illness in the mom, preterm birth, even stillbirth. So it's important that pregnant people stay up to date on their vaccines. But what our study suggests is that for moms where their routine updated vaccine might fall in their third trimester, those babies will be extra protected from COVID. What we can't answer yet with this study and would be a topic for future research is if mothers who received an updated vaccine before pregnancy or very early in their pregnancy, if their babies would benefit from an additional booster dose. But we can't say for sure that it would be warranted. So this was not surprising to us if you think about antibody kinetics. Most antibody transfer during pregnancy from the mother to the fetus occurs in late pregnancy, around 28 to 36 weeks of gestation. And COVID antibodies produced after vaccine wane fairly quickly in the first 6 months after the vaccine. So if you're vaccinated even right before pregnancy, by the time you're in your second and third trimester, there are just not as many antibodies around to transfer to the fetus at that time. So that means that pregnant people should not assume that their babies have any protection from last year's vaccine. And it also means that there's no benefit of delaying the vaccine until after the pregnancy ends. So we found vaccination at any time during pregnancy, we found reduced hospitalizations by 50%, and if it was given in the third trimester, reduced by 2/3. And so infants under 6 months are the age group with the second highest rates of hospitalization from COVID after people over 75, and that it was still true as late as the data goes through 2025. In terms of absolute numbers, of course, this thankfully is not a lot of, absolutely, but about 3,000 infants are hospitalized each year. And to put this in perspective, compared with influenza, while there are fewer infant COVID hospitalizations than infant influenza hospitalizations, there are about 20 infant deaths from influenza yearly, infants under 6 months. And the mortality rate for infants hospitalized for COVID is nearly 1 in 1,000. There are about 3,000 hospitalizations per year. So actually the absolute numbers of infants dying from COVID and infants dying from influenza are comparable. Right now, ACOG guidelines are that everyone should stay up to date with their vaccine, regardless of whether they're preconception or during pregnancy. In the future, more research is needed to know whether a third trimester additional dose might be helpful for infants. I think right now, the prevention tools that we have in this population for mothers who are not falling into that, they're due for their next dose near the third trimester, I think. And for everyone, regardless of whether you've been boosted or not, of course, just interpersonal infection reduction measures are warranted. Of course, hand washing, good hygiene, reducing exposure to sick people. So studies from the Delta period showed that maternal vaccination during pregnancy was strongly effective for infants. And some studies, including one done at our site in 2022 that was led by Dr. Zerbo, who's the last author on our paper, that study suggested that there might be a decline in protection from the Delta period to the first Omicron period, or BA1, BA2. We were pleased to see in our study the protection in the later Omicron periods, BA4, BA5, and BQ, XBB, were similar or even in some cases higher than that we saw in the Delta period. So this shows that even in a maternal population with substantial prior immunity, as we're getting later and later, since COVID began, infants who are naive to COVID infection are still getting protection from the maternal vaccinations.